No, for a man who needs no introduction, our legend Dr. Udwadia will be talking on his journey in critical care. As everyone knows, he is the man who started the critical care at Breach Candy, and I think we can easily boast, at least in India, as the best critical care facility we have. I won't waste anybody's time and let the great Dr. Udwadia come.
Friends and colleagues, they invited me in Calcutta to speak to the medical fraternity on my journey in critical care, and I think it was vastly appreciated. And I felt since I lived in Bombay, worked in Bombay, and hopefully will die in Bombay, I might as well speak to you about my journey in critical care in the very city that I've been working in. I started in a very small way critical care at the Breach Candy Hospital in a room in B North. What was then B? Yet is still B North in Breach Candy Hospital. Sorry? No, that was the two. That was long before that. A room in B North. B North, there was a dragon of a matron, an English lady who thought she was the sister of Queen Victoria. She walked with her nose in the air and with a very proud mane. And I was very young, and she tried to bully me when I came in, which was in 1964, when I first came here. I stood it for some time, and then I gave her hell. From that time onwards, she respected me. I asked after some years for a room to look after very ill people. And that was in B North, and a small room. And we had a bed, a surgical bed. I said that the doctor who was looking after that ward in the day would also look after that room and pay special attention to it. We equipped that room with a monitor which only showed the rhythm of the heart, that is ECG basically. We had an endotracheal tube and facilities to sort of intubate patients, and we had everything. There was of course, there was no oximeter. You couldn't take the saturation. Pressure had to be taken every time with the arm, with the arm band, as you know, and it went on. Now, how did it fare? Well, I would say that we saved a few people, mostly people after surgery, post-operative people, and some people with illnesses like pneumonia. We had a breathing machine. It was a beamer's machine, the simplest possible machine that you could have. And we used that machine very often on people. I don't remember my victories, but I remember one lady who died. She was the wife of one of Air India's major board members, and known very well to JRD, who would ring me up and ask after her all the time. She had an intestinal obstruction, and she was operated upon. It must have been a long surgery, it must have been a difficult surgery, and I put her into that room and looked after her. For the first 2 days, she was fine. Then she started getting breathless, and then she showed also a fall in renal output for no reason at all. And then she started getting fluffy shadows in both her chest, and she went into what looked to me like pulmonary edema. She died. I must say, Mr. Tata, who inquired after, never said a word when I told him, I'm sorry, we couldn't save this lady. What did she die of? I said, I think she died of heart failure. But she was just 40, there was no past history of heart problems, nothing at all. And it bothered me as to why she should have died. ECG at that time was normal early on, remained normal. Sometime later came the article by Ashworth and Petty describing the adult respiratory distress syndrome. And then I realized that this was an adult respiratory syndrome, which had other organ failures also. I didn't know it, but then I remembered it. We met quite a few other patients after that. And the treatment for the adult respiratory distress syndrome was not just ventilating them but giving them PEEP. But the beavers had no way of giving PEEP. Necessity is the mother of invention. So what I did at that time, I'm not a great mechanical person. On the contrary, I'm hopeless. But I dipped the expiratory tube into water and dipped it about, say, 8 centimeters or 10 centimeters, and thereby got some degree of PEEP. It went on. It looked good to me at that time, but later on, I thought it was a dark spot in my journey. The people who were managing her were new. They were not used to emergencies. I was bothered every time at night. I had to go at night many times to make sure that things were well. Good number lived and good number died. And then came a patient which changed my life. Her name was Sally Singh. It was Sunday. I was going to take my wife and the children to the Regal. I remember the cinema, Regal Theatre. I can't remember what picture it was. And a phone comes from the registrar at the Breach Candy Hospital. Sir, there is an American lady who's been admitted. She says she finds it difficult to breathe. I have looked at her, saw her. There is nothing that I can find. She's functional, I think. You could see her tomorrow morning. We had been dressed, we were dressed. I thought there was time, why not on the way look at her? Bombay was a peaceful place. Traffic was nothing. We could reach the hospital in 5 minutes. I went up there and saw the lady. She was a lady in her 30s. I sat and talked to her. I found nothing functional. She seemed a very stable, strong personality who looked after the whole house. She was married to the chief of the Vaz company, an American company. The head of that company, incidentally, was a tribal person who had risen to that position. I still remember that. And I wondered and said, what the hell is the matter? I said, what exactly do you mean by difficulty in breathing? I can't describe it, doctor. I just don't breathe like this. I went over her with a tooth comb because I knew there was something going wrong. I went over her nervous system, all power, tone, coordination, nutrition, involuntary movements, reflexes, plants, everything, everything. They were perfect. I looked at the chest, I listened to her carefully, podcasted her carefully, I looked at it. I couldn't find a thing. I made her count and she could count to 30 and then she started speaking, so it didn't count further. I didn't sit, I never sit by the patient, but I went on standing. And then I find over 15 minutes that count again please, and the count had dropped to 20. But the power was perfectly normal. Am I dealing with a myasthenic crisis? I said, but she has no loss of power, no weakness anywhere at all. I had not the wisdom, but the good luck to get in touch with the resident anesthetist who came with the endotracheal tube which I asked for and waited. Oxygen was ready, prepared. I put her on oxygen by a nasal tube. Are you feeling better? Slightly. And then the drama starts. I'm going to make it a little dramatic because it was the greatest drama that I have been through in my life. And what I tell you will be almost the exact words that took place at that time. Are you feeling still difficulty in breathing? Yes, doctor. I don't know. I can't seem to breathe properly. I could notice that she was hyperventilating. Within 5 minutes of this, will you believe it, she stopped breathing. I must say I was panic-stricken. The anesthetist was there. I said, David, please intubate her. Please intubate her. You know, the bed had bars at the head in those days. And he tried to put his head in. He could get his head in, but nothing more. I can't see the larynx, he said. I can't damn. I said, please intubate her. In between, of course, we gave her oxygen. I forgot to tell you. There was one thing in her examination which I noted. There was a lump in her abdomen which went 3 inches above the symphysis pubis. And I said, this looks like the uterus. Have you had it examined? He said, no, doctor, I'm 3 months pregnant. So this went, and I begged, for God's sake, in between, of course, I would give her oxygen, and ambu bag connected to oxygen, pumping oxygen into her. And I had to do that for her, for him to intubate. And he couldn't intubate. And she got blue. And when she was blue, she was pulseless. Or she would have a rhythm disturbance, a VTAC or an AF. It was a miserable time. I said, God's sake, damn you, you are an anesthetist, intubate. He said, sir, I can't see the light. I care a damn. I said, intubate. I'm saying the exact words that I used. Then he said, I pushed the tube in, sir. I don't know where it is. So I listened to it. It was in a blind push. It went through the larynx, into the trachea. And therefore, we could now keep her in with her ambu bag, keep her ventilated. We brought in at that time, we had graduated from a Beaver's to a Bird's machine. We put her on the Bird's machine, got her settled. I looked at her again. She was all right. Paranormal, tone normal, everything, a 5/5 reflexes present. I think I must have, of course, I had sent the wife and the children home. I followed when at 10 o'clock or so, at 10:30 or so, I came home in a taxi. I was exhausted, sleepless for the whole night. In the morning, I said, let me finish the Parsi channel. There were lots of patients in those days at the Parsi channel. There were more Parsis then, I saw them, and I came there first, and I was shocked. She was totally, completely, absolutely paralyzed. There was not even a flicker in the finger or the toe. There was no movement at all. I knew it. I said, this is poliomyelitis. We hurriedly checked for that. It came out to be poliomyelitis. We had a harrowing time for the first 7 days because she had both a bulbar and a spinal poliomyelitis. I quickly had a tracheostomy done. And I realized that she had no palate, no pharynx, bilateral facial movements, nothing, absolutely nothing. She couldn't speak. There was a whisper, hardly a whisper. We shifted her from that room to somewhere on the first floor where I can't quite correct, but it was the first floor where there was a larger room, much larger room. She had an anesthetist friend whom they got in touch with in Pune. And he came over to help. Thank goodness for that, because I couldn't stay there the whole time. He decided to stay till she was all right. The first 7 days were miserable because with bulbar polio, the first time I saw bulbar polio, frankly, first time. She had marked swings in her blood pressure, marked swings, sweating, sometimes fall in her pulse rate, sometimes a marked rise in the pulse rate. She had rhythm disturbances also. She was very, very ill. We weathered all that. 7 days went by, she was a little better. She was on the Bird's machine. She had been cyanosed and hypoxic several times during this ghastly episode. I didn't mention that to her, of course. And then comes the phone. Apparently she had a brother who was the good cardiovascular surgeon in Los Angeles, in the United States. He could not be contacted because he was on a trek and there were no cell phones, etc. No way to contact him. And he had come back and he found out about his sister. So this is the conversation. Is that Dr. Udwadia? I said, yes. Your sister, my sister is under your treatment. I want to know how she is. I said she was very bad, but she's a bit stable just now. Right? I'd like to see her. I'm going to come over. You're welcome, I said. What is the blood gas? I said, I can't tell you about blood gas because I have no blood gas machine. What? You're treating my sister without a blood gas machine? I said, what am I to do? Then I lost my time. I said, your sister is alive because she has been with us and we've been slaving over her for so many days. If she had been at this time in the United States, she might perhaps have died because they might not have even admitted her to start with. He said, quiet. I'm coming with the blood gas machine. And the next plane, he came with a blood gas machine in the next plane. We took the blood gas machine to the path lab at that time. The fellow said, I don't know this. And how can I set this machine up? I don't know how to set this machine up. So the poor man, doctor, tried to do it. He couldn't do it. He said, what am I to do? I'll tell you what I'm doing. I'm going to take this machine back. I'm going to learn how to set it, and I'm coming back. 7 days later, he learns how to set the machine. He comes back, sets the machine up. There's a little teething trouble. The machine worked beautifully. That was the first blood gas machine in this country. That's how it was. Would you believe it, ladies and gentlemen? We kept this lady on the birth ventilator for the next 6 months, and she delivered on the ventilator. Of course, before that I told her, listen, I would be surprised if your baby has been badly damaged because you've been cyanose hypoxic for such a long time. I think we should abort the baby. Everyone said that, that was me. She had refused. I will not. There was nothing I could do. And again, can you believe it, ladies and gentlemen? The baby was born, was perfectly healthy. Don't ask me how, don't ask me why. This lady remained completely paralyzed. Her brother took her to Los Angeles, to the best physiotherapy center, and she came back after 5 or 6 months, with some movement, some little movement on a wheelchair, on a machine, with the tracheostomy. Sometimes they would remove the tracheostomy, and ask her to breathe, and there was some intercostal movement in the intercostal muscles. Diaphragm remained paralyzed. And then he told me a strange thing, that besides the physiotherapy, they taught her frogs breathing. For the life of me, I didn't know what that was. So the husband explained, they taught her to have a bolus of air in the mouth and so maneuver it that instead of going into the stomach, it would go into the trachea. 7 days I tried to do that. Full 7 days, when I had the time, I would try and swallow air and hope that it went into the trachea. I got a distended stomach and said, this is not me. Anyway, so that was, her name was Sally Singh. We kept in touch with her and she was well. I had a lovely husband who supported her to a T. And I had kept in touch with her for almost 15 years or 20, perhaps 20 years. I don't know what happened later. This was in the 70s. Right. It was then that I asked the managing committee to please provide me with at least a small intensive care unit. They were nice people, they were Angrezes. They were heads of great, large firms and managed large companies. I was very young, actually, but it's amazing what respect they paid the doctor. Amazing. There was a Mr. Tarrant, I well remember. He was chief of Hindustan Lever. And I asked Mr. Tarrant, this is what happened, and we need to do something about it. We need a real good intensive care unit. So you give me what you want. So I gave him what he wanted. Shall we start first with 2 beds? I said, yes, all right, we'll start with 2 beds. So we started with 2 beds, and that was the time when we had in A North 2 beds. I can't help thinking of patients, that I saw at that time. There was this lady who was the young lady, 19-year-old girl who came with eclampsia. Seizures, one following another, epilepticus, status epilepticus. I insisted that the gynecologist do a cesarean and remove the baby. That was the first thing to do. We had a torrid time. She was the second bed in that ICU. Real torrid time. Jamshed was there at that time, I think. Jamshed remembered that lady, no? Yeah. She had florid ARDS. She had multiple organ failure. And I don't know how she survived. Marked hypertension. Everything that was bad. But she was young. And we slaved over her, God alone knows. We muddled through and she lived. That was a great victory, I thought. So that was one. And there was another funny patient came. Dr. Hiranandani had done a fantastic operation where he had disemboweled the neck completely for a cancer somewhere or the other. There was nothing left in the neck at all. And we would stare in, with what is happening. In the night, this lady bled. And when she bled, it was probably the carotid or something because the spark, the air hit the ceiling. So there was a rush, everybody rushed. But it was such a messy looking thing that nobody could stop the bleeding. And it was not going up because the pressure was zero, it was just spluttering. And then the smallest houseman of mine, a sleepy old chap called Shah, comes in his half sleep, in his pajamas. What is the matter? He said. I said, this fellow is bleeding, get out of the way. He said, well, where is he bleeding from? And he looks at it. Oh, wait. He goes to the side table, picks up an artery faucet, put it somewhere, the bleeding stops. That's something again. You were there, something? Huh? Yeah. This is the other thing that I could never forget. And then, of course, we asked the committee for a larger ICU, and we had the 8-bedded unit that you see now. It was designed by an English architectural firm at that time, and it was very well designed, I think. The sister sitting at the desk could see 4 beds, another 2 beds. She had to swivel around to see the 7th bed and the 8th bed. And it became a nice unit. There was Sister Amaria, who was a permanent head. She was a fantastic sister, I must say. She trained the girls. We all trained the girls. I called Jamshed, asked Jamshed, who was at that time, I'd sent him to the KM hospital to learn something about pacing, etc. I rang him up and said, Jamshed, look, we've got this unit, you better come over now. I think Jamshed came over. So to Jamshed, myself, Sister Amaria, and some excellent nurses that we trained to a T. They were trained to do everything, including giving DC shocks, including treating, promptly treating arrhythmias, because they were taught to identify arrhythmias as and when they arose, and it was splendid. Jamshed was a sole person there. Can you believe it? 8 people. Sole person. No one at night. Just day and night he was there. He had a flat just above. You were in a flat just above the ICU. The hotline to him. He would come down in 2 minutes, up, out, into the room, and manage any, except for intubation, which the nurses wouldn't do. They could do almost anything in an emergency. And it ran very smoothly. And there were 2 things which I did at that time, which I think were remarkable, because all other units which were starting had remarkable severe nosocomial infections. I used to go to them. I was called to see them, and I know that. There were 2 things. Not only that, they had severe nosocomial infections, and they considered a ventilator as an enemy. So that patients were given put on the ventilator as a last stop to heaven or hell. And those who were on the ventilator, it was believed that you should get it out as quickly as possible. So in 24 hours, 36 hours, get out the ventilator, so that the patient will act exactly as it was. So anyway, this was how it was. And yes, there is another thing that I did. I said, I know why these nosocomial infections are there. Because everything, particularly the patient's urine, stool, ablution, skimming, was done by these poor so-called class 4 workers. They were dirty. They had dirty khaki uniforms. They never washed their hands. They touched everything about the patient. So I made it a rule that patients' ablutions were to be done by the nurses. And the nurses were told why nosocomial infections occur. And the nosocomial infection rate from the beginning came down sharply. And another thing, I had heard of Ignaz Semmelweis, and he had said, wash your hands. And that I put into practice, not as much as it was these days, but I insisted that they be given the antiseptic before they touch the patient and out to the left of the patient. These 2 features which I introduced in the unit was responsible for a sharp fall in nosocomial infections. And still, it is one of but this hospital is one which is, I think, perhaps the least nosocomial. For example, we don't see nosocomial infections in ventilated patients. It's very rare, even those who are ventilated for a long time, exceptions. Only thing that is still there is central line infections. And I made it a rule also that the central line has to be changed every 8 days. Yes, what remarkable patients we had. We had this young pediatrician who was the pediatrician to my grandchildren when they were small infants, 1 year old, 2 year old. She came with a dreadful illness, and till now, I'm not quite sure what the illness was. In medicine, it's always wise to say, I don't know, rather than you say something which you're not sure. I said, we're not sure. What is it, a poisoning? Has she taken a poison? What is the reason for this multi-organ failure? The poor girl was on a ventilator for over 30 days. She was thin. By the time 30 days old, she had shriveled into like the size of a small child. We were desperate. I don't know whether Jamshed will remember these things, but one day I was looking rather sad and extremely depressed, And he taps me on my shoulder and says, don't look so worried. She will live, I think, she will live. That was a smile. Remember that, or you don't? That was a smile to my face. And she did live. They all went to celebrate, but I kept aloof. I didn't want to become a hero. I just wanted to be aloof. I'd done my job, and it was a good job done. And of course, there were very many VIPs, so-called VIPs who came. The rule was treat them as you would treat a good patient. Please. We did that, but there was great stress. The stress. There were secretaries, there were people, prime ministers visiting them, many people visiting them, all Congress people, these people that were visiting them. The pressure was greater when they were very ill. But I was young, and I could take that stress in my stride. At least I would show it in the room or in the unit, but it would give me sleepless nights, of course. And there was a time when they brought in people from outside, that surgeons and physicians saying that we should transport this very important person back into a very good ICU unit in London. And I watched amused because I knew they could do nothing. The man was in sepsis, not in septic shock, but in severe sepsis. So I went up to him, and my dear chap, we had a good rapport. I had a good rapport. And said, they want to take you away to a unit in London. It's up to you. I don't mind. You can shift if you want to. He said, no. I like this unit. I like the doctors. I like the nurses. I'm not going. And there were some young puppies from there who were very bright, of course, but very clever. And they insisted that we should be able to get him better there. But there was also a wise old man, close to his 50s, and he was not a physician, he was a surgeon. And he had a powwow with these puppies and said, no, he's been looked after extremely well. It would be wrong to take him away. And he was left there. The pressures were immense. At a point in time, I said, we need to do a tracheostomy on him. And there was a hullabaloo about that. What happens if he dies? What are you doing? He's so ill, you're going to do a tracheostomy? Can't we wait for some time? I said, a tracheostomy is indicated. We did a tracheostomy. There was a point in time when he had a fetal fistula. And there were surgeons around who said, you have to close this fistula. And we had a surgeon here, very mature, excellent surgeon, who said, no, doctor, no, Farooq. I think we should leave him alone. And he gave a beautiful reason for that. He said the fistula is in the ileum. The rest of his gut is fine. He could continue to absorb food from that, so why worry? And then I remember one classic incident. here, which I shall never forget. It was 10 o'clock at night. And this, I told your dad, and I think I told you before, that your mother, we cannot save your mother because she's done for. This particular person had a cancer of the pancreas, and because they were moneyed, they took her all over the place in the United States. And they literally eviscerated her. Besides the pancreas, after some time, they removed the stomach, they removed the spleen, they removed half of the liver, they removed this, removed that. There was nothing left, and he was sent back to us with two fistulas oozing pus from her tummy. She says, "What? How dare you say that?" I said, "I think it's just funny for this." And then you know what he did? He fiddled down in his pocket and put a revolver on my desk. I was not amused. I just looked at him in his eyes and said, "Is that a colt?" He was, puzzled. "What?" He said. I asked him, "Is this revolver a colt?" And he said, "No." "What is a colt?" he asked me. Colt was the name of a man who first made the great proper revolver. It was called the Colt. No, this is, I think he said Browning, I don't know, I might be wrong, something or the other, which I also hadn't heard of anyway. And then, "Doctor, if my mother dies, I will shoot you." I said, "Is that so?" I said, "Cowards die many times before their death. Why didn't you shoot me?" Again he put his revolver back into his pocket and went out. That was another fine incident. That was fine thing, which I don't think I've even told Zahir about that. Those were some of the incidents that we had. There were units that sprang up. They were bad units, believe you me. As I told you, there was a great deal of nosocomial. Nobody knew how to ventilate patients properly. They were given, as I said, the last sort of placatory step before they left the world. Ventilators either were put too late and were removed too soon. There was a great deal of nosocomial infection. And there was a spate of so-called critical care units in the city, small little rooms called critical care. The whole idea was to make a lot of money, and it went on and on for a long time. I used to go in those days to see people who were very ill outside. And it was miserable, particularly in the 80s, and the 70s and the 80s. I went first to a patient in Calcutta, a Marwari gentleman, extraordinarily rich, I was told, who had fractured 5 or 6 ribs. So when I went there, I said, "This is simple. Come on, put in an endocrine tube, get a machine, and we'll put him on a ventilator, and he'll be fine after some time." But there was no ventilator. So I said, "Get a ventilator." You won't believe it, we rang up 6 places, hospitals, rooms, nursing homes, etc. First they would say, yes, we have a ventilator. Phone comes like, "It is under repair." Next phone comes, it's not working. There was no ventilator in the whole of Calcutta at that time. That was in the 80s. Can you believe it? Late 70s or 80s, I'm not sure. Madras was no better, but Madras from the beginning had superb physicians. I could see that. They were really good physicians. Because, I took a round one day with a professor of medicine at the Madras Medical College, Thiruvengal. His name was a dear man, good friend. And I could see that he is a super physician. Now, if you gave them, I said, if these people get the proper setup, they will be excellent. And that's exactly what happened. Today, Madras is the center which beats all the other centers flat. Because they have good equipment now, good doctors, good physicians. And then, of course, I must remember this. And then what happened was, this was again in the 80s. I was at the JJ, as you probably know. I was there from 1959 and spent 30 years at the JJ teaching people, teaching students. One day, and I tell you exactly what happened. The man who was looking after the tetanus ward was a GI person. His name was Dr. B.J. Vakil. And he, poor man, unfortunately died of a heart attack. And his assistant was Dr. Kapoor, which most of us know. He used to have big teaching sessions for so many medical students. He comes up to my ward and says, I want you to take over the tetanus ward. I said, why? It's yours. I said, it's not my baby. You go on. No, no, please, I beg of you. Please, I can't manage. Please, please, please. I said, okay, take me to your ward. The tetanus ward. That was the time I first saw tetanus patient, except of course in my registrar days at the KM, where I used to look after the tetanus ward. The only thing we used to do was give paraldehyde. There wasn't even Valium available in those days. It was a charnel house. People convulsing like mad. 2-3 corpses wrapped up in white sheets lying there. I said, please. I said, I can't. This is horrible. How the hell can you manage this? So I beg of you. I said, all right, let me see. Tell me which 2 patients of yours, which 1 patient of yours is going to die tomorrow or the after. This one for sure. You can't see, I can't feel his pulse. I can't feel his pressure. He's got severe tetanus. He's in continuous seizures. Okay, I said, I will take him up on one condition. I will take 2 of your worst patients to Breach Candy Hospital. And let's see what happens. We took 2 of their worst patients and they survived. And they survived. After 6 to 8 weeks of heroic struggle, they survived. So I said, pity, I said, I will take this up. So I took up the treatment or the management of the tetanus ward. It was a horrendous task. But I tell you, the way my boys and girls worked there, non-stop almost for 48 hours without anything, was a delight to watch. I would go there not only during the day or many times, but I would go there at night after I finished my rooms. Poor Veera would be sitting in the car and I would be there till 10 o'clock or 11 o'clock. That's that. But I had to do something about it. You couldn't run a ward like this, I said. So I had to get machines. There was no ventilator at all. There was nothing. It was like a boiling place because all the windows were shut and there were 2 fans whirring. Windows shut because with light they would have seizures. So I said I must do something. At that time I was not earning great things. I was pleasantly off, I must say. I never cared for that. But I used to go to Hext Pharmaceutical 1 day in the week. And that day in the week, my job was to reply to complaints and letters written to Hext about their drugs. And I used to write the most amusing letters back to them. Hext tells me they've still kept them. Such amusing letters. And the man who was the charge of the medical side of these was a German called Mr. Winternitz. He was Germanic. Truly Germanic. So off and on there was a contact. One day I walked into his, Mr. Winternitz, I have a favor to ask of you. You're such a rich company. Do some charity. I need ventilators, please. What for? I told him about the tetanus. I had to see it first. Typically, welcome. I said, what time? He said, 9:30 in the morning on this day. So the boys were prepared. I told them, stop all muscle relaxants. Let them twitch like mad when he comes. Like mad. Let them twitch like mad. Winternitz comes in his suit, tie and all that. Small man, but a very typical Germanic man. Had a table for him. Had a table. Had a chair. I told him, after 5 minutes, get the JJ Hospital tea with biscuits. So Winter, I just saw this. I could see him pale as a sheet. Windows were closed, 2 hands for a German living in Germany. This was terrible. He was sweating like a pig from every pore. I said, I don't want him fainting. That's not so bad. I didn't sit down. Sit down. He sat down. Then I went on talking. He just had a black, glazed stare about it. Then came the tea. You know what the JJ Hospital tea was like. I mean, we were used to it, but it's all right. But for Mr. Winternitz, the tea was real fun. Mr. Winternitz, some tea. Yes, please have some tea. And I took my cup and gulped it down. And he took his cup and shook, put the cup down enough. He said, I'm going, and please, Mr. Ventilus, please, you will give us ventilators, won't you? Exact conversation I'm telling you. Yes, let me go. I will. That's how I got our ventilators, and they were Bennett's. I remember, they were Bennett's. And then, of course, I had to air condition the place. It was impossibly hot. So I went up to my Tata friend. What was his name? I forget his name. He was in charge of Voltas. He was the man in charge of Voltas. I forget his name. But he was a very nice man again. I just went to him and told him. In a minute, he said, I'll do it for you. Finished. So we now had a tetanus ward which had beautiful ventilation, lovely air conditioning, cool as cool could be, and ventilators. We had, however, 3 ventilators, and they were, I think, 3, 6, and 3, 9 beds or so. What happened with the others required ventilation. That was the time when I said, we should ask the Breach Candy for help. I went up. Believe this is again a remarkable thing. I went up to the committee and I told them the story. And I said, I beg you to let me bring patients who cannot be treated in the JJ hospital to Breach Candy Hospital, please. You won't believe it. They all said, okay. There were 2 Indians there. They were all Angrejis. I think 1 American. There were others were all Angrejis. The 2 Americans were Kuldewala at that time. He was there for a long time. And another person called Akbar Ali. Not Akbar Ali. I forget the name. What's the name of that nice man? Very nice man. Aristocratic man from Hyderabad. Huh?
Wagle?
Sorry?
Wagle?
No, Wagle to pachi aaya Jamshid. Yeah. Akbar Haidari. That's right. Akbar. He was a lovely man. And they stood up for it and said, yes, we will do it. Anirudh, in those days, of the 8 beds, sometimes there were 4 beds with tetanus patients. And they got the full treatment. Everything. It's a remarkable thing. Can you show me the tetanus thing now? I remember this poor boy very well. He was one who lived at the JJ hospital. And another incident which I must relate. One day a telephone call comes and at 12 o'clock at night from a resident of the JJ hospital, sir, the terrible thing has happened, I'm very sorry. I said, what has happened? I thought the building has collapsed, something has happened. No, sir, there's a terrible thing that happened. I made a great mistake. I said, what is the mistake? Please tell us. He said, my first instruction was, anyone who comes admitted with tetanus, they were all from the streets, had to be thoroughly scrubbed with soap and water to take out that mud and the mud on them. So instead of using water, the guy used carbolic acid. Because the carbolic acid also is like water, and the 2 water bottles and the carbolic water bottle were placed side by side. And I said, what happened? He said, I've only gone up to the 2 legs, sir. I've not gone over the body. I said, I used some filthy abuse and said, take him to the Breach Candy immediately. This was the worst case I've ever seen. Multiple organ failure, burns produced by carbolic poisoning, causing literally acute renal toxicity, required numerous dialysis, got a lunus, he survived. And that is so strange. Another one who was next to him was well. He'd recovered perfectly well. He suddenly dies. I learned then that sometimes those who are expected to or you feel are going to die, survive, and those you almost feel certain who are going to live, die. And the thought always crossed my mind, is this preordained? Is this all written about? Are we mere earthlings just fiddling around and thinking that we are doing great things when it is all decided? But the problem is we do not know which way it is decided. So we continue to fiddle around as best as we can. You almost heard of Umar Khan. Yeah, always reminded of his poem more and more. The moving finger writes, and having writ moves on. Nor all thy piety nor wit can cancel half a line, nor all thy tears wipe out a word of it. Amazing, saying that everything is preordained. So that was as far as tetanus went. And of course, we did well in this unit. We improved all the time. The nurses were excellent. The doctors were excellent. Jamshed did a great job. And I must not forget Jain here. during the tetanus days, during the tetanus days, Jain would often have to go in an ambulance to the tetanus ward and bring the patients by ambulance to Breach Candy Hospital. And he would sometimes say, "Sir, I had to give him cardiac massage in the ambulance." I said, "Well done, Jain. He's alive still. The great guy. Where is he? Is he there? He's not there." Oh, Jain. Remember Jain? Am I right? Right or no? Right. He used to tell me that. And after Jamshed came Jain, and he was also a tremendous asset to our unit. Tremendous asset to our unit. So this is how it was. What's the time?
Almost.
Yeah, I almost. Let me try and finish. I asked myself when I went to Calcutta, what good did I do in this journey? What did I achieve? I don't say achieve is a proud word. What good did I do during my journey? And I think I can modestly say, first of all, that I taught generations of students. Generations of students. And I think a small part of me has probably gone into them and they will pass that on perhaps to future generations. But it will ultimately out. After all, history tells you that nothing lasts forever. But that's a good thought that I had. What else? Well, besides doing that, I think I started this in a very small way, very, very small way, almost like darkness when you compare it now, and helped to consolidate critical care in this country. The third thing that I did was that very ill people, I cannot get more ill people than people with tetanus. If you spend treating tetanus for months, you get tetanus, I promise you. Bring down the mortality. Show me the mortality. Look at the mortality figures that were there. In the hospital before 1982, it was overall 30%. And grade 3, grade 4 tetanus was 100% at the JJ hospital. And look at the mortality here. After 1982, overall mortality was 12%. And severe tetanus, I'm talking of JJ hospital, 23%. And at our Breach Candy Hospital, out of the 30 severe grade 3, grade 4 tetanus that we brought, only 2 died. That was a remarkable feat, I think. So that's what I did. And also, I made my observation. I used to write and make my notes. Children were there at that time, little children. I used to write notes on the papers, and I used to write notes also, make observations of everything. And these observations I put together in the book on critical care. This was not a book copied from Western people. It was a book concerning critical illness in our part of the world, as seen by me in our part of the world. Show me the first one. Show me the first one. The previous one. Yeah, this book was written very early. When is it written? 72. 72 with Dr. Rustam Jal Vakil, who was a dear, dear man and a real mentor. A perfect gentleman in the true sense of the word. And then came the critical care book, I think. Show that book. Then came tetanus. And that is a standard textbook now. I was a bit sad that you don't see tetanus now, actually. But I'm sure there's tetanus in the world. Look at Sudan, look at Africa. Surely there must be tetanus there. Look at the wars that go on in all parts of the world. Surely there must be tetanus there. I hope they are reading my book so that they can treat them well. The next one. Show the next one. This was another one. There were only two other good books on acute respiratory failure at the time when this book was published. One was by Petty and another was by an Englishman, an excellent book by two English people, which I read thoroughly. And again, what I had here was what I saw, the patients that I saw. And this is the first time that I reported about 12 or 13 patients of ARDS in our part. The first description of ARDS was in this book. And the next one. And of course, we had, where's the book on the the critical care book?
Yes, sir.
Are not this. What's the matter with you? That's all. These are the books on critical care. They've gone into 4 editions, and I think it is the standard text here. There's also a book on in medical clinics, bedside clinics, which also contain many patients who had been critically ill, and so on and so forth. So that's, I think, the good that I did, the little good that I could do. And just a few comments. Few comments. The first comment is that empathy and compassion are as important as your expertise in critical care. The second comment is faith is a great healer. And you can only have faith if you listen to your patient, talk to your patient, touch your patient, examine your patient, spend time with your patient. A very sick man has literally antennae, like the mother has for a child. Antennae that makes out a person who's really genuinely physician, who's really genuinely caring for him. You'll be surprised. And he makes out true compassion and true empathy from pseudo-compassion and pseudo-empathy. It's a great thing because it bonds the patient and the doctor. And it is a bonding between the doctor and the patient that breeds trust. And it is trust that breeds faith. And faith heals. Make no mistake about it. Also, more things are wrought by prayer than the world dreams of. Believe me, that also I think is true. The third thing I think you need as a person, as a physician, is equanimity. Equanimitas, as Osler called it. My father was a great example of that. He had perfect equanimity. He was never ruffled, always kind, always kind. I wasn't born with equanimity as he was. I was a tempestuous fellow in my younger days, and I had to cultivate equanimity. Even now I sometimes lose it, but it is so important. It is very important not to show emotion, worry, tenseness, panic, fear, dread in a person who is very ill between life and death, because that upsets him and often tilts the balance. Calm and cool makes a huge big difference. Is there anything that I learned? I learned that you treat everyone the same way, not the rich and the VIP differently. If you do that, you will never know good medicine and never practice real medicine in the true sense of the word. And finally, in these days, it is important not to protract the act of dying. You must do that with reasonable common sense and, of course, bearing in mind legal boundaries. These are some of the things that I have observed. So I take my journey as being from darkness. I call that darkness because there was something into it, but it's still, compared to now, it is darkness. From darkness into light. And I was not alone. I had my wife with me. She held my hand and we walked together from darkness into light. Before I end, I must thank everyone. I am hopeless thanking people. I forget the people who I must most thank. But all my housemen and my residents and my nurses at JJ, at Parsi General and at Breach Candy. The strength of this hospital lies in the nurses. Believe me. They are kind. They are compassionate. They last always. For writing everything or putting everything on the computer. And where's my friend John? He's a real good person who knows his physical, the pulmonary function beautifully well, perhaps better than me and others. I thank him for he also puts everything I write on the computer. I did burn the candle at both ends. There was a time when I did that. I was working in the day and writing at night, sleeping at 1, getting up at 6:30 and working the greater part of the day. But I remembered Emily Dixon, the poet, her words, lovely words, simple words. The candle burns at both ends. I know it will not last the night, but it spreads a lovely light. I'm not talking about myself. I just remembered those words and I said, let me work, because I can afford to work just now. So that is how it is. I normally end by giving you some poems, and I haven't spoken poetry for a long time. So I shall do so. I'm thinking of Robert Frost. Have you heard of Robert Frost? Yes. All of you? Yes. Yes? The woods are lovely, dark and light. And I have promises to keep. And miles to go before I sleep. Miles to go before I sleep. By the way, I've lost so many friends, so many dear ones on this journey. I just lost one 3 days back, a dear friend. They leave scars on your heart. I must be having a scarred heart. I don't know why it continues to beat, Zari. It is time that it stops now. I know you won't like me saying that. And finally, the last poem before I end. It's by a great American poet, Whitfield. He wrote a beautiful book on poetry called The Leaves of Grass, which I read many years ago when I came back from my studies. And he was a man with a huge beard, unkempt hair, American, and he never lived in cities. He wandered around in the countryside of America. And when he was dying, he says to his friend, let me glide silently forth with the keys of kindness, open the locks. Open the doors, my soul, gently. Be not impatient, for strong are the bonds of human flesh. Strong are the bonds of love. Thank you. Thank you. Shall we?
Yes.
Shall we have to?
Yeah.
Indeed, a very touching, endearing, a journey that brings tears to our eyes.